door is not adequately blocked. So this is filling from the right gastroepiphyloid artery, which is anastomosis with the left gastroepiphyloid artery, which is a branch of the splenic artery, which is communicating with this pseudonym, which is filling the back door of the pseudonym. So this was not adequately covered, that's why it is refilling from the back door. So that is the relevance. If you don't block it, back door, it is going to fail and the patient will come with a recurrent bleed. In this case, the further angiography will be very, very difficult. In this case, we reached the back door, but the catheter, because of redundancy, we could not reach the neck. We embolized using a glue. We successfully blocked the back door, and the pseudonym is no longer filling. So now moving on to the angiographic technique, we need the diagnostic catheter where we cannulate the celiac axis, SMA or IMA depending upon the source. And we go through the transfemoral route. These are the diagnostic catheter. One should not carry this catheter beyond the ostium. And the injection rate in a celiac axis and the SMA has to be in the rate of 4 to 5 or 5 to 6 ml per minute. In IMA, one has to be very, very slow, that 2 to 3 ml per second. Don't inject too fast, too forcibly, because the IMA is more formed for dissection. Once you cannulate the main arteries, to reach the smaller vessel, use the microcatheters, advance the microcatheter carefully, avoid spasm, dissections, reach the site of bleeding as close as possible. Okay, once you reach the site, use the embolizing agent. We have a lot of embolizing agents. These could be temporary or permanent. Permanent include coil, particles, and glue. Coils come in various sizes. The microcoils are the ideal embolizing agent for GI bleed because you are dealing with a very, very small branches. The recommended size is 10 to 20% oversize the vessel diameter. Suppose if you have a 3 mm vessel which is bleeding, you can use a 20% oversize, but the coil does not come in a 3.6 mm. So what you can do is use a 4 mm coil diameter, that will be sufficient. So the coil has a metallic component which acts as a physical occluder, and it has a fibers which are thrombogenic. So the ideal site in GI bleed, if it is a SMA territory, the ideal site is the vasa recta, where in case of the IMA territory, it is a marginal artery. Remember that. So this is a SMA territory, vasa recta marked here, and this is a case of a tubercular ulcer. We reached the vasa recta and used the microcoils. This is a case of a pseudonym from the marginal artery. So you don't have to go to the branch. You just put a coil across the marginal artery, that is sufficient. So the next embolizing agent is a gel foam. It is a temporary embolizing agent, easily available. You can mix it with the contrast to make it visible and slurry. But remember that the results are very, very unpredictable. If it is too thin,